Sound Health comes to you every Tuesday at 5:30 p.m. and we try to highlight trending health issues from around the world. Today we are looking at dementia. According to the World Health Organization, someone somewhere suffers dementia every 3 seconds. We will try to find out what causes this condition and how do we prevent it. Stay tuned. The conversation begins after this break.
New data from the World Health Organization reveals that nearly 1/3 of adults are not active enough. That's 1.8 billion people missing out on the many physical and mental health benefits regular physical activity offers. Globally, women are less likely to be active than men. In some countries, this difference reaches 20 percentage points, highlighting a significant gender gap. Although physical activity is key for healthy aging, inactivity rises sharply after the age of 60 for people almost everywhere. By 2030, it is estimated that global levels of inactivity could rise to 35%. These new findings are a wake-up call. This WHO report has a clear message. We need to get moving to help more people be more active. This will require governments and stakeholders across sectors to partner to implement policies and programs, particularly to engage more women and older adults, to provide more support for innovation and local solutions, and to better align resources with policy commitments. Whether it's walking, cycling, dancing, or playing sports, regular physical activity is good for everyone. Let's all work together to get the world moving.
The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Idris Abdulsamad. He is a clinical physiologist in neurophysiology, and he is going to tell us what exactly is dementia and how do we prevent the onset of dementia. Good evening, Abdulsamad, and thanks for joining us.
Thank you very much for having me.
All right, I am Abdulsamad. Tell us, what exactly is dementia? The World Health Organization says someone suffers this condition every 3 seconds.
Okay, dementia is a syndrome that is used to describe progressive neurodegenerative diseases that are associated with cortical function, cognitive processes that include language, memory, decision making. So it is a disease that progresses over time, and it is a disease of the brain. So that's basically what dementia is all about. So it's as opposed to memory loss, amnesia. This dementia does not just stop at the person forgetting past or recent occurrences. They tend to lose the ability to even speak at times at some stages of the days, and then decision making becomes a difficult task. And so many other activities they tend to carry out on their own on a daily basis becomes very hard to accomplish. So that's basically what dementia is all about.
Okay, in your response, you mentioned that it is a gradual process. It doesn't just happen. So before we talk about the signs and symptoms, because you mentioned some of the signs, how do you know that this is dementia, or must you wait till you get to this stage where you can't remember anything? And what are the causes of this condition?
Okay, so as explained earlier, it is used to describe diseases that affect or that is associated with impaired cortical function. So now there are so many diseases that can cause the person to have dementia, and there are different forms of dementia. So to start with, there is a very common type of dementia, which is Alzheimer's dementia. So this Alzheimer's dementia has not really been fully explored, in the sense that only a little bit of information is understood about Alzheimer's dementia. And so far, it is the most understood form of dementia so far. So there's a lot to be discovered as regards dementia, and the specific pathology of dementia is not fully discovered yet. So it has been found that in patients with Alzheimer's dementia, there are some proteins that are found to be culpable in such patients. So when they take their brain samples and then they check, there are some things they call tau proteins rather, and then some other proteins that are found to be culpable in such patients. So apart from Alzheimer's dementia, there are also other forms that includes the vascular dementia, meaning when we say vascular, we're talking about vessels within the brain. So neurovascular dementia, which is vessels within the brain, that causes dementia. And then there are other diseases like of infections. So we have infections. There's a prion disease, otherwise known as Creutzfeldt-Jakob disease, that can also cause dementia. And some genetic factors have been found to be implicated in some patients with dementia. So there are so many other things that can cause dementia, including atherosclerosis and some other things. So those are basically the most common types. And again, Alzheimer's dementia is found to be very common in 60 to 70% of patients with dementia.
All right, thank you, Abdulsamad. You mentioned that Alzheimer's dementia is also a type of dementia. Oftentimes you hear people say he's living with dementia, he's living with Alzheimer's. Is there a thin line between them? Are they the same?
Okay, so when we say dementia, again, it is a group of diseases. So we can't say they are different in any way. It's just like a type of dementia. It's just like when you say they have different brand of cars. They are all cars, but they are different brands. You understand? So they can present with different symptoms, and some symptoms can be specific to some types. So the difference now will now be the cause, like the background cause. So for some, it could be trauma to the head. So the trauma can cause maybe bleeding. So with that, you can say maybe there's a vascular cause of the dementia. So with Alzheimer's, it is as a result of protein. There's a protein, I mentioned tau protein earlier, and then there is another protein, I remember the name now, I'll let you know. There's another protein that also is involved in the Alzheimer's dementia. So that's what makes Alzheimer's dementia what it is. So it is a form of dementia. There's no difference between them. But also they are used interchangeably, but Alzheimer's dementia is actually very common.
Apart from injury to the head, which you mentioned as one of the causes of dementia, are there also developmental milestones and other issues that will predispose someone to dementia?
Okay, so basically, according to the WHO, dementia is known to be a disease of the elderly. So it's not to be a disease of the elderly. So it's not something that starts from childhood. Although in patients that have Down syndrome, which is as a result of trisomy 21, that's a genetic mutation sort of, we can experience dementia in such patients when they probably grow old. However, in below the age of 65, so there's a very small percentage of such patients that have dementia below the age of 65, but it's majorly a disease of the adults or the elderly.
Okay, apart from Down syndrome, have you seen cases in your field of experience, cases where children come up with this condition, with this disease?
Okay, so as far as I know, I haven't come across any pediatric patient or young adult that has dementia. So far, there has been none.
Okay, so
Yeah.
are there also lifestyle changes apart from hereditary genetics, that could also lead to dementia?
Oh, yes. So, according to some research, it has been found that some lifestyle uh, um, behaviors can be attributed to the risk factors. So apart from age being the most common risk factor, that is people above the age of 65 are more likely to come down with dementia. There are some drinking habits, physical inactivity can also be attributed to the risk factors that causes dementia. Also, smoking is also a risk factor for dementia. And then being over blood pressure, when people with high blood pressure, high sugar level, which is diabetes, the high blood pressure, if it's consistent with hypertension. So those are the risk factors. So we have those lifestyle activities that can predispose one to having dementia.
Okay, can this condition be prevented in people? Because you never can tell if this person will come up with dementia in the future. You said it's a disease experienced by the elderly.
Yes, yes.
So can it be prevented?
Can it be prevented?
Yes.
Okay, so about preventive practices, it's simply just keeping a good lifestyle. That's basically just it. And this is not to say these risk factors are going to, for those that drink or smoke, that are definitely going to have dementia. We're only saying that this will predispose one to having a higher tendency of coming down with dementia. You understand?
Yes.
So, yeah, so that's basically it. So there are some self-care practices that can be, incorporated into one's lifestyle to reduce the risk of having dementia. And also, there are some things that we do that when we do have that dementia, the impact will not be so, or the progress will not be as fast as some other patients. So for those that engage themselves cognitively, that is, they do a whole lot of mental tasking, it will take a while for the dementia to make them have that cognitive inability to perform some certain functions.
Okay.
So now, the effect of dementia on cognitive function has been shown to be higher in those that have maybe a lower educational
Background.
level of education, for those that have lower level of education. So being mindful and being mentally engaging in activities can reduce the effect of dementia on your cortical function, basically.
Okay, can dementia be treated or managed or reversed? Is it reversible?
Okay, so one, dementia is not reversible as far as I know, and according to the WHO, and there is no cure for dementia as we speak. But a lot can be done to actually support people living with dementia. So you can't treat it, you can't reverse it, because it's a progressive degeneration. Once the cells start dying, they continue to spread. The proteins that are causing that cell death will continue to spread to other parts of the brain. Usually they start from maybe the hippocampus and begin to lose memory. solution for such patients is to maintain their quality of life and promote their well-being. So again, being physically active can help them, and also social interactions and helping them or encouraging such patients to participate in activities and interact socially would also stimulate the brain, because it has also been noticed that in patients that have dementia, they tend to isolate, they self-isolate. So it helps them a lot if or when they interact socially with others. So it really cannot be treated, neither can it be cured.
Okay, regardless of the stages or types.
Regardless, it tends to progress. So it cannot be cured, or maybe the symptoms can be managed, but it can't be cured.
What do you think people can do to live well despite this condition, and your call to action?
Okay, so for those that have dementia, self-care is the best advice. So for them to always stay physically active, eat healthy, stop smoking or drinking of alcohol, then regular checkups with doctor helps. And then for some, medication can be given to help with remembering some activities, and then lifestyle changes basically. So it all boils down to lifestyle changes.
Okay, this condition can be physically and emotionally draining for not just people living with the condition, but as well as their caregivers, family, and loved ones. What advice do you have for loved ones, family, caregivers?
Okay, so for caregivers, basically they need to just plan ahead of time. So over time, it may be very hard to make decisions. That's for the patients with dementia. It might be hard for them to make decisions on their own, to even clean themselves. So for caregivers, it is important that they understand the problem. So they should look beyond how the patients are behaving, and try to understand the problem they are having, so that they will be able to administer better care for such patients. So the caregivers will need to be patient and understand that what this patient is going through is not, or their actions are not, deliberate. So when they tend to forget things, they can help with, helping them with facing themselves. And for some of them, at some stage, they will need to be fed, because at severe stage of dementia, patients can even forget to, or don't know how to swallow. So they might need help in carrying out some of those basic life activities for them to, have or maintain a better life, or a good quality of life, as long as they remain.
All right, Abdulsamad, do you have any final words for our viewers?
Okay, so basically, I would say that dementia is like so many other diseases that can be managed, and it can also, or we can also reduce our risk of having dementia. So in current times or in recent times, we see people taking so many chemicals, drugs without prescription, and then people take a lot of illicit drugs, they mix them together, and it is very, very bad. So we have instances where people come down with a whole lot of neurological disorder as a result of drug use or misuse or abuse. So my advice basically was to desist from all of these things, and also try to maintain a healthy lifestyle. So apart from drinking and smoking, we should always try to check our heart, the functioning of our heart, know how our heart is functioning. Try to, for those that are hypertensive, have a BP monitor to always monitor the blood pressure, because once the heart is affected, it causes an impairment in blood supply, and the brain is a very important organ that requires constant supply of blood, and this is because the blood carries oxygen and nutrients required for the brain to function. So once there is an impairment in the function of the heart, the brain is also implicated most times. So we should always try to, be intentional about our health, basically. So that would be my advice.
All right. Be intentional about your health. Health is wealth. Prevention, they say, is better than cure. Idris Abdulsamad, clinical physiologist in neurophysiology. Thank you so much for your time and expertise on dementia.
Thank you very much for having me.
All right. I have been speaking with Idris Abdulsamad, clinical physiologist in neurophysiology, on dementia, how to prevent dementia and how to manage dementia in people living with the condition. Sound Health continues with trending health report from around the world. Please stay tuned. The program has been Sound Health on Lagos Television, and we have been discussing dementia this week, how to prevent dementia, how to manage it. Unfortunately, this condition is irreversible, but it can be managed. People living with this condition can live a better life when they have or experience patience and love from their caregivers and family. You also need to be intentional. See a medical professional early enough if you're seeing any signs and symptoms mentioned by Abdulsamad. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.